Thank you for joining the NAMI Maryland conference. My name is Toon Gardeniers. I'm the NAMI Maryland board member, and I'll be moderating this session. I won't be presenting. This workshop session is called From Hopelessness to Hopefulness, and it's presented by Beth Albaneze from House Calls and Dr. Alexis McKenzie, also from House Calls to Total Wellness. You can read more about our amazing presenters, including their full bios in the digital conference program on the official conference website. Navigating the maze of community resources alone is overwhelming. This workshop will demonstrate and facilitate strategies and techniques to be your own advocate and choose advocates to walk you through the mental health system. If this is not the workshop you're meaning to attend, you need to click on your browser and go back to the conference site. We will be addressing questions at the end of this presentation. If you have any question as the presentation goes on, please post them on the social wall on the right-hand side of your screen. I guess that's here. And we will be reviewing the questions, and if something particular is unclear or needs to be expanded, we'll ask our presenters after the presentation is concluded. If you have any concerns, technical issues, you can also use the social wall to chat in there. When you're posting on the social wall, please be aware there's a 20-second delay. And when this workshop closes, you'll be prompted to fill out a brief survey. And if you would like to receive CEUs for this workshop, some of you may want to, you must complete this survey in order to qualify. Okay, so without further ado, I would now like to hand it over briefly to Beth.
Hi, everyone. Welcome. I'm Beth Albaneze. This is Dr. Alexis McKenzie. And as you see, we are ready to begin, but we want to show you a video first so we can condense all the information about what we do in one spot. So turn it over to the video people, and then we'll get back to you in a minute. So welcome to our session from Hopelessness to Hopefulness. We are going to have the PowerPoint up in a minute, and then we'll be able to start our presentation. Here we go. So what is House Calls Total Wellness? We are online or face-to-face mental health support. We are one-stop shopping with an array of services. We have a team of specialists all under one umbrella. We provide a wraparound approach, children, teens, adults to senior citizens. We advocate with schools to ensure the most effective accommodations are in place for students of all ages facing life challenges. And we meet with you where you are most comfortable. So we need to go to slide 4, probably, Dina. We're on the next one, which is from hopeless to hopeful. What is the role of an advocate? I would go, yeah, the next one after that. Purpose. The goal of this session is to focus on the issue and impact it is having, to learn how to remain outcome focused, not to personalize these issues that are arising, to identify who to present this issue to, what is the person, where's the person that's giving you the problem or the agency or whatever, determine where the system is failing you, have examples, establish rapport to prevent defensiveness, and think of what you want to see happen as a result. So keep that in mind. The role of an advocate is to be an advisor, one who pleads the cause, your cause or someone else's cause, a defender, someone who helps promote validation, who fights for you, who helps you navigate the maze, and looks for the right fit for you or your loved one. That's very important. Next slide. So you want to think about someone in a setting, whether it's assisted living or it's day programming or it's the doctor's office, an agency, a hospital, another professional, or a family member. If you can take a minute and think about the different settings that you've experienced with a loved one, with yourself, or just a client, whatever the situation is, take a moment, because we're going to turn over now to my wonderful colleague, Dr. McKenzie, and she's going to get us ready to be in the right mindset for the rest of the presentation.
So when you're thinking about these situations that you may have had an interaction with a loved one in an assisted living or a day program or at the doctor's office, the hospital, even with another professional or a family member, you want to make sure that your own mindset is where it needs to be able to communicate in an effective, non-threatening, non-judgmental manner. Because when we're in the present, when we stay in the present moment, that's all we are supposed to be focusing on, the present. Not what happened yesterday, not what's going to happen possibly next week, or what happened last week. So any situation, and it may be something that happened to a loved one the week prior, but the mood that you need to come into the situation with is to be open and be present and be able to stay calm, because that is the key. And I want you to just think about any kind of a issue that you may have had with someone in an agency or the other areas that we talked about, assisted living or a hospital. And think about yourself being an advocate for that person, or think about yourself having to be your own advocate, because that's what's going to come up next. Next slide, please.
Every professional should have the skill to advocate. That's the most important thing. And everybody on the house calls total wellness team learns that as a #1 priority. On our team, we have certified recreation therapists, mental health case managers, life coaches, recovery specialists for addiction and substance abuse, holistic counselors like Dr. McKenzie.
Maybe Beth, I'll offer just a few things about what that means.
Oh yeah, please do that.
Thank you. So you might be wondering what a holistic counselor is. And a holistic counselor is one who really focuses on mind, body, spirit healing. And by that, I mean, you want to be as centered as you possibly can in your daily life. Who doesn't want to be? And that's what I focus on as a holistic counselor for House Calls. I focus on listening to people, not just about what they have to say, but how they're taking care of their body, how they're eating, if they're eating healthy or not, and why, and some enjoyment things. I want to talk about that with people, or if they're not enjoying life, just really looking at the person from the entire total well-being of their daily life.
Absolutely. The good part about this also is that we are all under one umbrella. So we have a team approach. Even if we go to the home, we have different specialty areas that might be in the home. And as far as advocacy, self-advocacy or provider advocacy, it's up to us a lot of times to know when someone does need to advocate for themselves, they're not getting their needs met, or we need to step in and suggest that. So if we go to the next slide, please. So when do we hire a professional? And it's important to see the signs. If you're the type of person that is feeling too anxious, whether you're a provider, whether you're a client or just a family member, if you know that anxiety level is going to get in the way, that would be a sign. If you've tried to tackle things alone over and over again, and we get a lot of calls like that, and there's no result, unfortunately, sometimes people stop listening to you, and it's really disrespectful. So you turn to us or you turn to another provider, and they may take you more seriously, even though that's sad to say. Sometimes you might get too involved emotionally due to a personal connection, or for some other reason, it's just hitting you and it's a trigger. It could be a colleague that you need to deal with, and you need someone to help because it's just too upsetting, or the person has the type of personality that you feel will get too defensive, and then you might not get anywhere. Or you don't know how to make a formal complaint. It could be you need to complain to an agency, an institution, the state, a supervisor, whatever it is, there's protocol. And sometimes that's definitely an anxiety-producing situation. Or it's a matter of health and safety. That's always good to have somebody else on your team. Next slide. Are you being heard? Another reason you're not taken seriously, as I mentioned a minute ago. The staff does not understand the issue. You're calling referrals, you're calling different people, and you're going through that maze. We talked about initially navigating that maze. You're getting nowhere, and it's very frustrating. You're getting mixed messages, different advice from different people, and you're totally overwhelmed with the confusion of what to do next. Or you don't have a captain of your treatment team, and so there's no one to make a final decision about what the problem is. You're a person and you need assistance, but the other person is resistant to your help. So you're a family member and you know you need assistance, and you need assistance maybe for another family member, and they don't want that assistance. That happens all the time. You're getting inconsistent messages from people, or you feel that you're getting blocked and turned away, and the messages aren't clear. And again, things are a matter of health and safety. Health and safety is a real issue. That's when you might want to think of a professional advocate. Next slide, please. So self-advocacy is when you or your loved one is attempting to get results on your own. Provider advocacy is paying or engaging an agency, professional or individual, to assist on your behalf when you don't have the answers, you just don't know. Self-advocacy is if you already know how to access resources. Provider advocacy is used when you have attempted to no avail. And self-advocacy is used when you already know what the desired outcome is that you're looking for. Next slide. So there are different types of advocates. Parent advocates for a school counselor that needs to intervene on their teenager's behalf. The teenager may not want to go to school, and we don't have any idea why. And we need help, and we need an advocate to get a sense of a situation. Could be a teacher, could be the teenager is in a class over their head and they're not verbalizing it, and then they want to stay home. A lawyer advocate. In cases such as appeals, Social Security disability is a big one when people get turned down and they think that's it, and they really have a right to appeal, and they're afraid they're going to lose, and this is everything to them. Sometimes they need to know what type of lawyer, not just a lawyer, but what type of lawyer will fight their case. DDA funding, that's another huge one. People getting turned down when they had an individual, a family member who needed funding for a crisis, for residential, for day treatment, for everyday vocational job coaching, whatever it is. When DDA turns you down, it's big, big, big impact. So you want to know that maybe you need a lawyer to fight your case. Child protection, disability rights, that's when you really need a lawyer to talk your case to someone else who's their equal in terms of professional knowledge. They talk the lingo, and sometimes it's the lingo and just the wording or the clinical sentences that somebody else says that just gets somebody to say, they may have a point. Let me go back and look at this. Neighborhood watches. A lot of neighborhoods now are doing neighborhood watches to protect their seniors. They're alone, they're vulnerable, and a lot of senior neighborhood watches, they're willing to do something on a regular basis, whether it's to come visit them like a friendly visitor or play bridge. There's much more recreational engagement than people realize if you join a neighborhood watch. You need to know where they are though. And then the neighborhood watch people are your family members' advocate. And even providers can tap into the neighborhood watch to help them with their clients. So you find advocates everywhere, in community organizations, volunteers at an agency, community members, and different county services. But if you don't know where they are, you need to reach out and let us help you. Anybody in the field can help you, especially NAMI. They're the best of the best. Next one. So what skills do you need? You need to have active listening. I think the best class I ever took in college was active listening, because you have to know how to validate somebody, and you need to do your homework and prepare if you're going to be your own advocate. You need to stay calm. And as I said in the other slide, try not to personalize the issue. And I know that's very, very hard. Have a plan B. It probably won't go exactly how you expected. It usually doesn't. But if you're prepared to go and have an alternative plan in mind right then and there, you maximize your time with the person that you need to advocate for. And do not get intimidated or defensive. There's no reason to. You're just as important as anybody else, and no question is stupid. Ask what they are going to do to make it right. You really want to know before you leave that you have something that they're going to do that will let you know that they're going to follow up with whatever it is that is the issue. And if you're walking out and you're still frustrated, which can happen, and you feel you're going to have to go to another level, just agree to disagree with that person, remain respectful, and just say things like, well, that sounds interesting. Let me think about that. And then you move on and do what you have to do. Next slide. Active listening is essential if you are advocating. And those are skills, like I said, validating somebody, using eye contact, Sometimes not using eye contact is also respectful, depends on the culture. So you have to be very aware of people's culture. Making sure that you're sitting down when someone's sitting down and that your tone is respectful. Speaking without judgment or escalating your tone. That's a skill to have because you can really feel that you want to get angry and you have to keep it in check. Giving a compliment at the outset to establish rapport. Try to find one thing that might be going well that the person has done, and you want to just let them know you really appreciate that, and then you start the meeting. Speak also as if you understand their position too. People, as I said, love to be validated, even the people that you're going to deal with as far as advocacy. What do you expect moving forward by this person or someone else, and when? And making sure that they are validating your needs in the situation before the meeting's over. Your needs need to be heard. Next slide. You want to say something?
Yes, I was just going to think about this for a second. When you had said, make sure your needs are being met, sometimes it's good to ask them if we could just recap it.
That's right.
So my understanding is this, or I think I heard you say this. And then that way, everybody's clear and all expectations have been met and no one walks away feeling unheard or upset. It just doesn't leave the door open for that.
Absolutely. Totally agree. Next slide. Alexis, I'm going to let you talk a little bit before, actually, I'll do this one and then I'll let you go because I want to make sure I say that you want to identify what you want to accomplish from the communication. But sometimes what you want to accomplish has to be done either by email, by phone, luckily maybe face-to-face, or it might have to be telehealth. So you want to understand what is your preferred method of communication. That's number one. And if your preferred method of communication is email, phone, face-to-face, if you're writing a doctor, the doctor might not write you back because of HIPAA. So you don't want to get real defensive that he's not taking you seriously. You want to check and see another form of communication because it may just be that it is HIPAA. You also want to know the mission of the agency. You want to know the mission of the facility. You also want to know what someone's professional role is in that facility. What should have been accomplished by now? And how has this lack of attention had an impact? Next slide. So Dr. McKenzie is going to talk a little bit about specific situations that I'm sure you've encountered or you want to prepare for in case this happens.
Thank you, Beth. So if you are in an assisted living situation, you have a loved one there, or maybe you yourself are living in an assisted living, and you notice that the residents that are living there, you feel that they're not safe. Perhaps there are a lot of people that have cognitive issues and you feel that they are going in and out of people's rooms or they're trying to leave the facility. Maybe you feel like your loved one is being ignored or there's not really a lack of social engagement or appropriate engagement. And by that, I mean that, let's say I'm the daughter and my mom is in an assisted living. And each time that I go there, I'm noticing more and more that my mom is not being invited or reminded that there's a program going on. And that would be a lack of appropriate engagement. Now, there's many reasons for that. And I won't get into all the clinical reasons. So the reason I bring that up is because there's always two sides to a story. And if I'm making an observation about another family member and thinking they need to be engaged, and I make comments about that, A, that's really not my business, and B, sure, I'd be a concerned person, but there may be reasons that I don't understand. And dementia apathy is one of them. So if you see that there are cognitively impaired people in an assisted living, appropriate engagement may just be that individual needs certain things. Like my mom may need certain types of activities, but I want to take it upon myself to go to the correct source to find out who I can speak with. And is it the nurse? Is it the activity professional? Or I think they call them engagement specialists or something like that now. But regardless of what the title is, it's always important to go in, as Beth said before, and not be defensive and try whatever setting you're in. Just try to be as calm as you can and state what you've seen, state what you feel, and then see how you can move forward in a positive way and not be so judgmental about the situation before going in and hearing what they have to say. Maybe my mom is not engaged, or my dad, or my sister, whomever it is, they're not engaged because they're not feeling well, and I didn't even know that, okay? So there's always reasons. Medication issues. Now, there are so many different medications out there, and I'm not going to get into a whole big thing about medication, but we all know this. Medications do come with side effects. We also know that the efficacy factor when a person is cognitively impaired and they're moving along that track of becoming more cognitively impaired, some of the medications aren't as effective. And if we're seeing it as the daughter or relative or outside caregiver of a person, just have the conversation, ask for the information so that you can totally understand about that. I think it's safe to bring it up to have a question, but if you're not a person who is a nurse or a medical doctor or anything like that, there's no way that the person would know every side effect to every drug. So it's important to just state your concern about any medication. I noticed that since my mom's been on this new medication, she's sleeping more. That's an observation. When I come to visit, she's sleeping more, she's not remembering who I am, or she is not eating like she was when I would come and join her for lunch or dinner. Those are concrete, substantiated things that you can bring up. They're good examples instead of just saying, I don't know, I just think she's on the wrong medication. Well, it's always helpful to give some type of reasoning behind your I don't know, because it helps the staff to also know who to send you to get your answers, your questions answered. Incidents. There are definitely incidents that happen in our everyday life, and there are incidents that happen in a congregate living situation too. Now, cognitive issues where a resident cannot accurately make a report could potentially be a concern for a family member, and I definitely understand that. Case in point, and we will probably have time later to do some case studies, but my own mom was in an assisted living and she had vascular dementia. And she kept pointing to her leg and saying, my leg, and rubbing her leg. And the staff was noticing that, but there wasn't any further investigation. So when I came to visit, I said, I'm really concerned. I know she can't express more than my leg, but it appears to be that she's having some type of pain, because I can tell by the grimace on her face. I can tell the way she's pressing her leg or trying to rub her leg. So it's important to understand that the issues around cognition can be serious in the sense of accurately expressing what is going on. So it's important to be as much of a detective as you can possibly be and work with the staff so that you can say, my mom just really is not acting herself. Have you noticed anything? Is she doing something differently? Because I can't make any rhyme or reason out of what she's saying. And then family concerns, understanding each discipline's responsibilities. There are many job titles within a facility, anywhere from nurses to nursing assistants or recreation professionals, housekeeping and laundry and maintenance, all type of titles. It's important to find out, whatever your concern is, with whom you need to speak, because it's no sense talking about something to the dining attendant when they're not the person that's going to be helping you. So it's important to find out who it is you need to speak with, whatever issue you need to have addressed.
I have an example too.
Yes.
I wanted to bring an example in that really upset me. I was in a hospital visiting a client, and I remember that a nurse had given her a menu, and the daughter is the one that referred her mother to us. But what she neglected to say was that the mother could not read. And so the next day she had no food because they left the menu and they expected her to pick up the phone and call the dietitian and get the food. And there was no food. Once I found that out, of course, I went all the way to quality assurance because I couldn't understand how no one knew to ask her a little bit more so she'd be able to get a meal. And that's just not something that you take that seriously unless you really, really know that the person is suffering because she was sleeping and she had all other side effects after a while because she had medicine on an empty stomach. So it's important also to know that there's a quality assurance office in every hospital. It could be called risk prevention, whatever it is. If you're not getting anywhere on that floor, there are more people that do not want to be sued, and they will come and intervene.
Next slide, please.
So you want to know the team players. In a hospital, there's mental and medical. You want to invite an advocate to family inpatient meetings and discharge meetings. There are many times when someone gets hospitalized for mental health issues, and someone says, the social worker, case manager, okay, we're going to be going home in a few hours. Are you going to be going home tomorrow? And they have a meeting, but they really aren't connected to the community. So the person gets out of the hospital and we get called because the person's home and there's nothing going on. Sometimes the psychiatrists aren't even speaking to each other. Sometimes the person's in the hospital and they're taking off their medicine and given other medicine. So it is very important if someone says you're going to be out of the hospital tomorrow, whether it's you or whether it's a family member or you're a provider, I want to be at the team meeting, whether it's telehealth, whether you go there in person, you have every right to be there as an advocate for a family member. And you want to make sure that there's an integration plan. So when you get out or when your client gets out or a family member gets out, that there is something that's going to happen right away to keep that person hopeful. You don't want to be hopeless when you can be hopeful. Also, in senior care facilities, it's very, very important to have an advocate there at care plan meetings. A lot of times people have relatives in senior care facilities and they're out of town. And we've had many a situation, if we have time, for examples, where if we weren't there, that person would really be seriously at risk. And I'm not saying there's any facility that doesn't have the best of intentions. They do have the best of intentions, but some people are short-staffed in facilities, or sometimes the senior hasn't verbalized anything, so they didn't know what was going on. And if you have an advocate monitoring that person and they don't have to advocate for themselves, they can go down and have lunch or dinner with the other people because someone knew that they were just getting their food in their room and they really needed to integrate. So it's very, very important that professionals team up and that they know that they need to rely on the nurse, the activity director, the social worker, the case manager, a family member, the doctor, hopefully. Sometimes the doctor, the psychiatrist or the medical doctor may not be present, but he's writing a treatment plan. He's part of the team. The most important thing I tell people is who's the captain of the ship? If somebody needs to make a decision about anything, and you have a doctor and you have a nurse, you have an activity therapist, a social worker, a case manager, or just a couple of these people, who's going to make the final decision with you? So you don't waste a lot of time. You need to have results. You have the right to invite your provider to be your advocate at these meetings, or you can contact an ombudsman representative from the risk prevention department. At quality assurance, they would have one, or in every county, they have ombudsmen. Ombudsmen are people that look out for the residents. They look out for the patients. They are there to help make sure that things move forward and no one is at risk. And we can tell you a lot more about ombudsman services everywhere if you would like more information at the end. A provider advocate is often helpful when a senior and a child protective services is involved. You have to have a provider involved with services like child protective services, senior protective services, because there's so much work involved in getting someone to come to the house when a senior's at risk or when they're calling about a child. There's so much paperwork, and it takes a while to have an investigation, that if you hire a provider to do things like that, it's much, much more important. So you want to understand the roles of the professionals that are working with your loved one. It's important to speak up for your loved one and express their needs. Next slide. So the resources, just a few that you can tap into: the Alliance of Professional Health Advocates, services in your county, all kinds of helplines, the local ombudsman who advocate for the people receiving home care, assisted living, nursing home care. Contact a CEO if it's an employer. Specialized lawyers, as we talked about, with Social Security, disability, special needs trusts, all of those things, mental health lawyer, supervisors, and the quality assurance department is everywhere because no one wants a lawsuit. Also, you want to join other families and groups to help solve problems, just like NAMI. NAMI is everywhere, and NAMI has every resource imaginable. You are not alone if you need resources in that area. We talk to NAMI all the time, and they talk to us. It's wonderful to partner up with resources in your community and know exactly what your options are. And you have the senior county resource directories. They're everywhere. And the Guide to Retirement Living magazines. And all the county information lines. If you call 311 in certain areas, 211 in other areas, there are all types of resources you can tap into. And if you don't know the resources, it's really, really important to get a provider to help connect you. Some providers are part of the agencies. They're not going to cost you any money whatsoever. It's their job to make sure you're okay. For example, like Montgomery County Guardianship Program. Sometimes you can go to them before going to a lawyer and paying for guardianship services. That's a lot of money. The next slide, please. So we have a little bit of time. So we wanted to go into a little bit of a situation that we've had in the past. And there are a few that are just highlighted that I would want to talk about. One is, and we're not going to mention any facility, we're not going to mention any providers, we're going to mention the impact that things have on people. There are usually regulations when there's a senior who's in a diaper. They're supposed to be changed every few hours. So if you notice that a relative is having a major problem because you're noticing they're not being attended to, that is when you need to advocate. You need to help out. Little things like that add up. They can get rashes, they can get infections. The sheets are a problem, bed bugs, it escalates, escalates, escalates. There are things that have happened when I've had clients who've been on medication and they finally got a job. They had a mental illness and they finally got a job. And they had side effects with their medication. And the employer thought that they were on drugs. Well, they were on the healthy medication. They weren't on drugs that should get them fired. And they were fired. And yet the only reason why they were fired is because the family couldn't get in touch with the doctor. The doctor was away on a trip and there was no other psychiatrist available to intervene and help all of us out. That shouldn't happen. A client shouldn't get fired. A person shouldn't ever have a situation where they can't reach their doctor. So you always have to know that if your doctor's not calling you back right away, there is either someone else that should be on call, or you call back and say, this is important. Somebody needs to reach that person. Even in the hospitals, they can be paged. Even in the residential facilities, you can go to the charge nurse and say, we need to talk to the doctor. My mother isn't getting released. She's been here for 4 hours. She was supposed to leave 4 hours ago. Why isn't anyone here to discharge her? That happens all the time. And it's all because of one signature that wasn't signed. Somebody wants a medication because they're in so much pain. Well, the doctor's not here to prescribe that medicine. Well, why can't we get this person some medication? This person is suffering. And then you hear, well, I can't prescribe this medicine. There are issues around medication that are very sensitive, but your relative or your client or your patient should not be in pain. Bottom line, if it can be avoided. Sometimes you have a test, PET scan, or any kind of MRI, CAT scan, or blood work, and you can't get the results. And you're trying to call and nobody's giving you the results, or you need to pick up the records because you need to take them somewhere else. And someone tells you, well, you need to have it done digitally. And you don't even know what that means. And yet you know that you're not able to come pick up the records that day. You need to find out what the protocol is to get records, and to know that if you're not able to get records or get results from a PET scan or an MRI or CAT scan, something's wrong. And you need to call whoever prescribed these things for you and have them represent you. They can be an advocate. Even in the school system, because we're so generic, we are talking about so many different situations, that in the school system, that's a whole other element where a child's getting bullied or someone has a disability and they're not getting accommodations, or they have accommodations approved, but the teachers aren't fulfilling what they need to fulfill to provide the best environment for someone with a disability. Or family members are trying to get disability for their children and they're blocked every step of the way. And so that's when a lawyer is involved. You can't give up. There are other options. And a lot of lawyers take cases on contingency. So you don't have to feel that you have to pay all this money, because you should know that the kind of lawyers we're talking about, have your back, and they really, really want to represent you. We've had this year, a lot of homebound students that it's a different situation from COVID, because they're told now they can go back to school, and there's so much social anxiety around going back to school that they want to remain homebound when they don't have to be homebound anymore. And that is creating a major problem. We have to work with people in the school system, the counselors, the teachers, to be able to be very supportive of some of the kids that need possibly a peer buddy. In a lot of these schools, you can ask to see if there's any other student that could be introduced to a new student, or a student who has a lot of social anxiety, or another student who has a disability, and they're just frightened about the school environment. There are ways to get your child in a system where they are stable and they are not escalated by the pressure that's going on around them in that highly stimulated environment. Next slide.
You've given so much great information, Beth. I think that this slide, it says visualize successful outcomes, is a really important slide. And I say that because when we do have a positive attitude and we think about having a successful outcome to whatever issue it is that we're dealing with, that's how we need to walk into a situation. And hopefully that's how we get to leave a situation too. And one of the things that we can think about going into a situation is just even taking a couple of deep breaths before we even begin to speak, before we even open the door to that person's office. Just get centered, take a few deep breaths, and I think that may just help to get you in the door and on the right foot. And then go in prepared, have a list of questions, and listen intently, and just think about your loved one or yourself if you're trying to get some help for yourself. And we had talked about many things, being a self-advocate, one of which is very stressful. And sometimes that's when you do need a professional like us. And it is helpful to know that we go from young people all the way up to seniors.
That's
and
right.
Being an advocate for them is definitely possible. And I think that the key is to be living our best lives and to take care of those we love, for them to be living their best life too. So whatever it takes for us to get us there, that's what's important.
So what we'd like to do is turn this over to you. We allowed some time. We could give you more case examples, but we much rather hear from our audience and see what kind of questions that you have. But we provided our email address. So if we don't have time to address all your questions, you'll be able to email us at any point in time. It's not over. When we're over, we're open to anything that you have to ask us and see if we can help you. So we want to find out. We can't see the questions yet, so we have to turn it back over to our technicians to ask us the questions. And thank you for your time.
Thank you.
Yeah, Beth, it's Tone here moderating. So I wonder, it might be useful for you as we wait for the questions, if you could do one of your cases as we're waiting.
Absolutely. Absolutely. We had a situation where there was a woman who had a psychiatric background, and she had bipolar disorder, and she was a senior, and she couldn't stay at home anymore. We were trying to keep her at home for quite a while, but then she was agitated and she had trouble walking, and it was her husband that just wanted to take care of her, but he didn't know what to do. So we came in, we tried to get home care for this person, but she was very angry at the idea that we thought she might be an invalid. She was very, very agitated at the idea that she couldn't remember things, and who could blame her? So what we did is we tried to get an assisted living facility that could be affordable, but that would take someone with a mental illness where her medications were still being explored. So she may have outbursts. She may have some problems being there, and she may disturb some of the other residents. We're lucky that we are advocates for a lot of seniors, or even people who are adults with disabilities, getting into residences where they normally wouldn't get into, because that is such a gap in our system, is housing. And I'm sure I'm talking to all of you, and you know that. So what we do is we contact places that we know will take someone if we're involved. So we try to make it a package where, please take this person, and we promise we'll be a part of the process, but we have to make it affordable. So we try to get the assisted living to discount their prices a little bit so the family will be able to afford us. The hardest thing is to say we don't take insurance, because the kind of work we do is it's such a liability. We're in the home. Everything we do is usually in the home or over coffee, because we like to break bread with people. So what we do is we called this person who I know who owned an assisted living. This woman was much younger than the age of everybody else. She was in her 60s, and everyone else was in their late 70s and 80s. But they accepted her, and she would scream at night, and she would have so much trouble. We got a psychiatrist to come over there, and he got to take Medicare, so that was good. He would prescribe medication. It took a village for us to get this woman to live there, but she lived there for 7 years, 7 long years, and she would never have lasted if this wonderful facility, who loved her to death, but they just needed more. We had one of my social workers would come once a week. We would have a recreation therapist come once a week. And then we would have someone from our team stimulate her muscles with balls and everything else, because the staff in an assisted living, it's hard enough for them to attend to the residents and what they have to do. And here's this one person who, because of their mental illness and physical disabilities, needed so much more, but she was entitled to have grace as she got older. And we are so grateful when we can do that for somebody.
I have an emergency, sorry. Go ahead, Lucas.
I have had nothing but coffee and so.
What's going on?
With regard to the gap in housing, one participant said, yes, it is a huge gap. Bless you for all you are doing. And that's one comment that was made by a participant is, this has been so insightful. Thank you. I would greatly appreciate a copy of the slides to enable me to share to others in our organization.
Well, what we do a lot of the times is we provide webinars for organizations. They can call us, and we usually charge a fee when we do things like this at a webinar in an organization, but it depends on the situation and we can work things out. We have a seminar that we provide. Alexis has Dr. McKenzie. She's Alexis now, you all know her. But anyway, she's done sessions for the school system. I presented actually all over the United States, and Dr. McKenzie is everywhere as well. We could tell you tons of slides that we have that might be good ideas for you. We could put on a series for you. So just write us directly and tell us what your situation is and let us answer that question personally.
That's one of the things that we do pride ourselves on this, is because we really listen to what your needs are. And then we can customize trainings and, as Beth says, webinars, seminars, all of those things via Zoom, in person, whatever it is. But we like to know what it is specifically that you're looking for, because otherwise, you know, we're not living our best life.
Well, and not only that, like, for example, we were asked to present to the Brem Foundation for breast cancer. And that is a specific situation that requires specific information and advice. And it was during COVID. So we did a whole thing on the new normal. And I just did an article for Health Magazine. What happens when you're diagnosed and you have all these restrictions, whether it's a mental diagnosis, a medical diagnosis, all on top of all the COVID stuff? It is so anxiety provoking. So there's a lot of challenges out there. And that's why we say our door's open, write us and we can see if we can help you. I shouldn't say door, because we come to you.
Well, as the participant says, bless you for all that you are doing. So I was very touched by your description. Sorry, I had to get out about the person that was bipolar and also older. And I assume this is a big problem, right? The combination of age and mental health. Is that something that you see growing at the moment? You hear a lot.
I used to be on the board for St. Luke's House and Threshold Services when they were separate, and then they merged and became Cornerstone Montgomery. And they were I remember Threshold Services in St. Luke's had this big project. They wanted to create housing for seniors. That was one of their biggest goals. One of their clients became our clients because whatever happened, I guess they didn't get enough money. And and she's another one. Oh my goodness. Do we have time for one more story?
What's that?
It's 3:15.
Yes, I think so. We have 5 more minutes. We're good.
All right, so I'll end with
Go
this story.
for it.
It came from Threshold in St. Luke. So this woman was about 55 and she was getting older, and they wanted to find out how has she aged, how's she going to live, where's she going to go. So I did the same thing with this woman. She went into another group home where everyone was in their 70s or 80s, and we agreed that we would be a part of the process. What happened with this woman was unbelievable, because when she first got there, she lived at Threshold for years and years and years. We thought she'd find housing at Threshold. We never thought she'd have to leave, and she didn't either. So she gets in there. First thing she does is she pulls the fire alarm. The fires, I mean, that was awful. Then she accused the staff of raping her. I mean, she was really, really determined not to stay. And so what happened is one day I came in and she remembered me from the week before. And she said she wanted me to come down and visit her. So I polished her nails and I put some jewelry on her. And I asked if I could take her to lunch, which you're not supposed to do if they're in that facility. They called her lawyer because she had a lawyer managing her trust. And the lawyer decided to hire us so we could take her to lunch and polish her nails and do her jewelry every week as recreation therapy. Believe me, it changed her life. We bought her lipstick. She wanted to go out to lunch with relatives. Everything changed because she felt like a human being. She had a purpose in the morning. She got up, she got dressed. It was like such a gift. She just died actually recently, and she was there maybe 10 years. But I wish we would escalate so people don't have to leave where they are and they can grow gracefully as they age in some of the settings they're already in.
Wow, what a touching story. Thank you for doing that. Not enough people doing that. Wow. So there's this other, you read this other comment. My loved one has really benefited from a life coach as she continues to recover and return to her work and relationships. So very similar. Yeah.
Yeah, and I'll tell you one thing, when people have drug and alcohol addiction, and sometimes people start with the drug and alcohol because they're compensating because they really needed the medicine.
Yeah.
Or sometimes they'll go off the medicine and they'll take the alcohol. And they go into rehab and they come out and they maybe stay 30, 90 days or whatever, and they come home and the stress is there. That's why we started having recovery coaches to go to the house when they get out and stay with them or talk to the family and find out what's going on so we can manage the stressors that got them there in the first place. So that's important, the life coach you're talking about, whether it's coaching, whether it's recovery coaching, which is very specialized for addiction, or whether it's vocational coaching, which we do. Any of it is so important for someone to have a quality of life.
A lot of us who have loved ones, also younger loved ones who have mental health situations, come back from being inpatient and have a very rough moment. So
Absolutely.
very important. Yeah. So I had to get out, but did we share your email and your contact? I think so, right? And I think that's also going to be available through the conference information as well. Is that correct? There we go. Thank you.
Yeah, and I sent it
there
out
it is.
twice to the participants through the social wall.
Yeah.
Yeah, okay, my phone number's right there. They're welcome to call. Are we still on or are we off now?
So I think we're done now. I think it's
We're still
3:20.
on, we're still streaming.
Yeah.
Oh, we are. Well, then if you look at the number 301-346-6732, that is my direct number. It's confidential. Please call me. I'll be more than happy to either direct you to Dr. McKenzie if you have a question about things that have to do with holistic counseling and mindfulness, positivity, gratefulness. She's the star in that. Or if it has to do with advocacy, hopelessness, whatever it is, we'll be more than happy, or a webinar, to provide it for you.
Thanks so much, Beth. And I need to close now, but thanks so much, Beth and Alexis, for
Thank you.
all you do and for giving us this information. And, you know, when this workshop session closes in any moment now, you'll be prompted to fill out a brief survey. If you would like to receive these CEUs, you need to fill out the survey. The next workshop session of the conference will be at 3:30. Please feel free to join. Thanks again.
Our pleasure.
And thank
Thank you
for
all.